Let me just wire myself up quickly and do a levels check, because if you're doing the presentation and you're in charge of the tech, that's not easy. So I will bring up one slide. I don't have a presentation as such, but if I can work this Windows 7 laptop, perhaps I can show you at least a couple of pictures while I'm talking about my case. That's not it. No, that's not. This is me in the hospital. I'll talk about this in a minute. So hi, I'm VERSLUIS, and I'm super excited to be here. I'm not a doctor, but I've been at the receiving end of the treatment as a cancer patient. And Karen refers to me as a super survivor. And this month is a very exciting month for me. She's given me this T-shirt when my treatment was complete. And my case was a weird one. It was very complicated. It was terrible. It was terrifying. And what cured me and why I'm called a super survivor is because the treatment that was successful in my case was in fact one of those newfangled drugs called immunotherapy. And that was not the first line treatment that I received. I also received chemotherapy twice. Neither of them worked. I also received surgery six times, and I've also received radiation. And all of that combined for about a year and a half, 2 years, was not successful, was not effective. And I nearly died. I nearly lost my life, bless you. And that was kind of the thing that was so terrifying. My life just kind of went down and down. And then eventually with immunotherapy, it literally took a dramatic turn up. And I want to tell you the whole story, and I'll try and condense it as short as possible, because once I get started, I kind of can't really stop about it, because there are so many nuances to that treatment, to the whole case. It was, so it started all. First of all, I've had cancer in my family for many years. My grandmother had it. She had breast cancer. That was in the mid-'80s, early '80s. Both her sisters had it. And back then, and this is kind of so exciting to look at it from today's point of view, back then in the '80s, cancer was more like a death sentence. There were limited treatment options. The only thing that doctors knew for sure was going to work was surgery with large margins. Don't leave the margins too small, large margins. And even then, chemotherapy was available, but were you going to survive? It was also not as convenient as chemotherapy is today. So today, we think of a 3-hour transfusion as inconvenient. But back then, I remember my grandmother was in the hospital. She was hospitalized. That was that. On my father's side, there was a big colon cancer issue. My father had it. His 2 brothers had it. But we didn't make the connection that was kind of perhaps a genetic link there. So we just knew there was cancer in my family, and that was kind of what brings me into today's world, into 2015, when my symptoms started. And it was bizarre at first. It was non-cancer related, really. It was something, diarrhea, UTI, weird kind of pain, shivering. So I went to see my primary doctor, and he said, let's do a CT scan to see what's going on in your abdomen. And that came back with, well, there's some kind of infection. Ideally, we'd like to do a colonoscopy, but that's not really possible because you're so infected. We need to wait and cool that infection down. Otherwise, we may perforate the bowel. And we did that. We waited. I had home infusion antibiotics. That was kind of my first brush with the US healthcare system, how that all worked. I've been living in London for 13 years up until 2012, and then my wife and I moved here to wonderful Miami Beach in sunny Florida. So the day came, a wonderful doctor named Dr. Para did the colonoscopy and said, I'm so sorry, I could only go in up to about 15 centimeters. There's a giant blockage there in your colon. So sorry, it looks like it's cancer. We don't know for sure, but I've seen this one too many times. I'm really sorry to tell you this. This is probably cancer. So lucky for me, I had already spoken to a colon surgeon at Baptist Hospital. And he said, I can do surgery next day, so one day after. That was at the beginning of 2016, February 1st of February 2016 this was. And he found, in fact, a 20 centimeter large tumor in me. So he thought, wow, that's a lot, but ample margins, cut it out, ended up with a colostomy for a while. And the plan was, let's give you first-line treatment of chemotherapy, FOLFOX, oxaliplatin, and that'll start until when you're healed up, maybe in about 6 weeks, 8 weeks. We're going to give you 6 months of chemo, and you'll be back on your feet. That was the plan. Didn't work out so well, I'm afraid to say. I did the chemo, and I did genetic testing as well. This is important because that kind of leads on to the second part of my story. They did a big genetics test, which concluded that I didn't just have regular colon cancer, because at my age, it was suspected that there may be something genetic going on. So I was 43 at the time. That is fairly young for a cancer patient to have that sort of, that big cancer. It wasn't T4, it was T3 only. So it hadn't metastasized into anything in my body, which is good to know. But they did the test. They found out, well, there's two kind of genetic variations there. One was the KRAS mutation, which means my cancer appears to be growing more aggressively, faster. The cells don't appear to know when they're not supposed to reproduce. They just reproduce all the time. They don't know when to stop. So that makes the cancer look more aggressive, I believe. I'm not a doctor, as I said. So the other thing that they found out, which was more important, which was mismatch repair syndrome. And that is something in which, from what I understand, when the DNA in your cells replicates, there's a spell checking kind of mechanism that says, hey, that DNA isn't perfect. Let's not build a cell around this. Let's discard this. And that system is impaired in me. So that means that's why I got cancer at such an early age. And the tragic news is that patients with those two mutations combined are 95% resistant to the chemotherapy drug that I got, which was FOLFOX, oxaliplatin. And so my doctor at Baptist Hospital, he knew this. I mean, he ordered the test. He knew this, gave me the FOLFOX treatment anyway, which is weird if we think about it. But at the same time, I spoke to Dr. Kuznia from Mount Sinai later on when my treatment progressed over there. And it turns out that's a political thing, that if you're a colon cancer patient, you get given this drug, no matter what the genetics test says. And that is something that needs to be addressed. I mean, that's something that's bizarre. Dr. Kuznia told me, well, to be honest with you, I would have had to give you the same treatment, and we had to see it fail, and then the insurance will approve other treatment options. And you think, oh, that's just ridiculous. I mean, why do genetics tests if you know the outcome of which dictates this medication isn't going to be successful? Why give it to the patient anyway? So, surprise, surprise, it didn't work. My cancer grew worse. About a week after my first surgery started, even before I started on chemotherapy, tragic news was that the cancer had, due to proximity, invaded my bladder. So I had it in my bladder. I had colon cancer in my bladder. I had colon cancer in my colon. And that was terrible. So anyway, we started the first chemo treatment, the first FOLFOX regimen for about 8 cycles. And my tumor just regrew. It just grew back in the bladder. It's massive. I was wearing a catheter, I had my colostomy, so I was wearing like 2 plastic things dangling out of me at all times. I had the wonderful side effects of the chemotherapy, and my life was just getting from bad to worse. And on top of that, the tumor had regrown. So what are we going to do? Well, says my doctor at Baptist Hospital, yeah, sorry, we can't help you anymore. We really don't know what this is, how to fix it. We don't have the staff at Baptist to take your whole bladder out, because that's the only thing we can do at this point. Radical cystectomy. So you're going to live with a colostomy and a urostomy, probably forever. But we don't know who can do it, so see ya. I don't know. He was the most depressed person that I've ever seen. I mean, I understand doctors and hardship, and you see patients, and patients die, and those are terrible cases. I understand that, but if you go to a hardware store and you say, "Do you sell oranges?" They say, "No, the supermarket across the road, they do that." But an oncologist at one of the big hospitals in the greater Miami area says, "No, don't know really. Don't you have colleagues? Don't you know anybody who can?" Anyway, so we were on our own, which was terrible, and we were faced with possibly a radical cystectomy. I didn't know where to go. And lucky for me, we had a good urologist who says, "Hey, I don't do cystectomies, but call this guy." So my urologist said that, not my oncologist. And he said, "Call this guy. He does all my cystectomies for me," which was crazy. I was thinking about how many cystectomies is that really. So 20 a day or whatnot. So anyway, we were referred to Dr. Casso, and Dr. Casso worked at Mount Sinai at that point. And we went to see him, and he says, "Hey, maybe I won't do much of anything for you, because go see Dr. Koritsky, go see Dr. Kuznia at Mount Sinai. Those are my colleagues. Maybe they can help you. Maybe a radical cystectomy isn't even necessary." So that was good. That was the first glimmer of hope that we had there. And we went to see Dr. Koritsky. He's a radiation oncologist. And he said, "First of all, sorry about your treatment." That's the number one. But number two, my buddy Mike Kuznia knows more about this than I do, but I think your 2 mutations that prevent the chemo from working makes you a perfect candidate for immunotherapy. And we thought, "Ooh, that's exciting. Let's speak with this Dr. Mike Kuznia and see what happens." And we did, and Dr. Kuznia said, "Yes, actually, I can probably get you into a clinical trial of something that may help you. But before we do that, I'd like you to undergo a second chemotherapy regimen, which was irinotecan, so that was FOLFIRI." And we did that in combination with radiation therapy, and that kind of shrunk the tumor, which had regrown from 20 down to 0, had regrown during chemotherapy back to 12 centimeters. Crazy. And due to the radiation, it had shrunk again to 6. That was good. So that was something that we thought, well, okay, maybe we're kind of on a good trip here. Let's see if this makes me healthy. Sadly, it did not. So although it did shrink the tumor, my cancer was still doing all kinds of havoc in my abdomen. So, for example, I now had a fistula between what used to be my disconnected rectum and my bladder. Fistula number 1. That was uncomfortable. As the treatment progressed, that my cancer kept growing despite the chemotherapy, I had developed a second fistula, this time from my small intestine to my bladder. So this was absolutely outrageous. I was getting weaker and weaker, and it came to the point where any food intake would reinfect me, and would kind of, not only was the cancer growing, I was also dealing with infections just due to food intake, because everything that shouldn't be connected was connected there. Absolutely traumatic and terrible. It got so bad that I was so weak we had to go back to hospital and see if there was another surgical option that they could do. But I was literally on the verge of dying there. It was just going down and down. And both Dr. Zomstein was my colon surgeon, and Dr. Kuznia and Karen and Dr. Koritsky, all of them together, we were all working on this tragic case across 2 hospitals. It was very exciting. And Dr. Kuznia recommended, let's take food out of the equation and give you TPN, total parenteral nutrition. So I don't take any food by mouth anymore. I'm getting it through my port. So I was no longer eating. I wasn't sleeping anymore. I had to go up for a pee every 15 minutes, day or night. And I was severely weakened, so weakened in fact that further chemo treatment wasn't even an option anymore. And I was so weak when we went to see Dr. Kuznia again in early 2017. We're talking February, just after I'd been released from hospital. I had a walking stick to barely move forward. Julia wheeled me across the hospital in a wheelchair just so that that I could go from A to B. I couldn't stand up anymore. Everything that's liquid in you just flows right into your bladder if everything's connected. It was absolutely horrendous. And Dr. Kuzny said, let's play my trump card. Let's do immunotherapy. We have no other options. This has got to work. But would it? That was the big question. Would it work? Because that's the issue. Even though the drugs are new, that small subset of patients exhibit amazing results, but many other people have bad side effects, from what I understand. So, early February, I'm barely walking. I'm unable to do literally anything, and Dr. Kuzny gives me Keytruda, the immunotherapy drug that cured my life. From a patient's point of view, an awesome change of events already. So there's the chemotherapy, 3 hours plus infusion in the suite, amazing side effects, hair loss, diarrhea, just nausea, all the candidates. Compared to the immunotherapy infusion, which was 30 minutes. Very exciting. 30 minutes in the infusion suite. Didn't feel like anything. Looks like a 250 milliliter clear saline bag. It's done within 30 minutes. Amazing. No side effects. Fantastic, I thought. That's great. Was it going to work? Well, we're going to find out. So that was early February, and we did one infusion every 3 weeks, was it? After 3 treatments, not much of a change. 4th treatment, I feel a little better. I can sleep a little longer. Those daily walks I was doing that were like literally snail pace around the block just to get a little bit of exercise, they were now possible again, longer and longer. I was feeling literally better every day come end of March. Beginning of April, I felt so good within a course of 2 months from starting the immunotherapy. Within 2 months that I could barely walk at all to I can walk at a regular pace again. I can't adequately describe the mental change that gave me, just the mood change. You're getting better. That's something I hadn't seen in a long time. And it just carried on from there. 4th treatment, 5th treatment. I was just getting better literally every day, even though the treatments were spaced out. So Karen said, even if you don't feel anything right away, it doesn't mean we're going to give you saline solution. We're not giving you the good stuff. It is the good stuff. It just takes a long time for the body to repair the damages and reverse the damages. And it worked. It worked absolutely flawlessly. It's amazing. It's a great, great transformation that was. And it went so well. And I don't know if you can see that. This is kind of gone to sleep now, hasn't it? It has. I was going to show you a picture of me riding my bicycle. I guess it's kind of gone to sleep there. I rode my bike end of April 2017 after only, 4 treatments? 4 or 5 treatments. I was so fit that I could go on my bike again and cycle the distance from where we live on 2nd Street in Miami Beach all the way up to Mount Sinai Hospital on 43rd Street. That is amazing. What a transformation. And so we decided, okay, we're going to leave these treatments up. They're good for you. Let's keep them going. And end of the year, we're going to have to put all the plumbing back. So we're going to have to take the colostomy back. We may have to do a partial cystectomy to reconnect all the bits that were now connected that weren't supposed to be. Wean me off the TPN. Remember, I still wasn't eating at that time. It was still the artificial nutrition that I was getting. 13-hour infusions overnight. Terrible ordeal. So the day came of the big surgery. I think it was in October 2017. And it was at Baptist Hospital. We had 2 top-class surgeons working together there. A colon surgeon, my Dr. Zomstein, my colon surgeon, and my urologist, Dr. Casso, had now transferred to Baptist Hospital. They were in the middle of building up their big new cancer center, which wasn't available at the time I was undergoing the chemo treatment there. And it's probably one of the reasons why I switched to Mount Sinai. And these guys, they put me under, opened me up. Obviously, I was unconscious at the time, but when I came to again, the stories they told me were magnificent. they had me open, and it's such a shame they didn't take video footage of it, otherwise I would have brought it with me today. They opened me up and looked at the mess that the cancer had left. And the most amazing thing was that they didn't find cancerous tissue in me anymore. So you got to appreciate what happened there. Not only was I severely diseased, not 6 months before, the immunotherapy helped my body put me back together, almost like on a molecular level, on a cellular level, that the cancer had just gone. It had attacked, my own immune system had attacked whatever ridiculous crap was going on in there and just reversed the process. It couldn't quite put the fistula back to where it wasn't supposed to be, so the surgeons had to do that. But they were both equally amazed to see this stuff is gone. It's no longer there. I no longer had cancer. And that was the most amazing transformation. Thank you. Thank you. What is so magnificent for me to be here today is that it is April, and this kind of the first step into this new direction, into this transformation, literally happened in April 2017. That's when we realized, my goodness, this stuff is working. This is working brilliantly. This was only 2 years ago. And I'm here today, I'm listening to all your wonderful talks and your wonderful input, the amazing new drugs that are coming out left, right, and center for all types of cancer. We're live on the internet with this. I was just speaking to one of my viewers, Christina McKay. Hello, Christina, by the way. She's in Germany. She's had a traumatic experience herself, and she just told me in the chat that she was so super sad to speak to a 10-year-old girl in the rehab center who had a brain tumor, and she knew she was going to die because there were no treatment options available for the type of cancer she had. And my heart goes out to that little girl. I just hope, and I mean, what we see today, I think it's going to become a reality, that with these new drugs, a super survivor, am the living proof that these things work. And they don't just work, they work incredibly well. I think that's all I wanted to share with you today. So thank you so much for listening. And thank you so much for having me.